Hi everyone, I'm Sivan,
I'm Kristen.
And I'm Allie.
and we have sensory processing with resilience. Now, resilience can also call stress management or coping ability. So we picked a really nice article that you guys gonna have access to. It's sensory processing in the general population, adaptability, resiliency, and challenging behavior. And we're gonna talk a little bit about it. So, should I start?
Of
Sure.
course.
All right.
Let's talk.
Um, basically, what the article talks about that people respond differently to sensory information. It depends on how soon they detect that. And when we talked in childhood about when they detect that, we were talking in sense of do they have a high threshold or low threshold, and even within high threshold or low threshold there is the passive active reaction. So this article basically take that and come up with four categories, which are registration, which is a high threshold but passive self-regulation, seeking, which they considered as also as high threshold but active self regulation, sensitivity, which is a low threshold, and passive self regulation, and avoiding, which is a low threshold and active self regulation. Also, sensory processing has been shown to be related but yet distinct from emotion and self regulation, and it's something that we should think about because we do know about other conditions with self regulation and emotion, such as ADHD. So, when you know information like that, you want to think about okay, so how is that translated in real life when you have a patient with ADHD? How is their coping mechanism? How are sensory processing for them?
Okay. So this article is going to extend off of past research, and they said that past research had found connections between what was it, sensory seeking and depression.
Mm-hmm.
And it also, with past research, they pointed out in this article that a lot of the past research has really focused on individuals with a certain disability, such as autism spectrum disorder or attention deficit disorder. And this article really was focusing on more generalization. So most of the participants didn't have anything diagnosed, and there was 5 individuals who were diagnosed with ADHD and 2 that were diagnosed with autism spectrum disorder, which was a very interesting thing that they brought to our attention.
Right, I agree.
I thought it was, while it's great that they're trying to go where no other research went before, a sample size of 51, and then out of it, you have it's like trying to touch too many subject or too many variable and combine it with one article and then missing all of it. It's like so you have 40 something that doesn't have diagnosis and only a few. How is it really applicable for person with ADHD? How is it really applicable for person with another diagnosis that has such a low representation? So that was one of the things that kind of popped in my head when I was thinking about it.
And we were talking about this earlier, and we just feel like, and Savannah was really pointing out that she feels like if they want to generalize this more, they need to just increase the number of individuals that don't have a diagnosis as well as the individuals that do. So do what they did, but just make the number of people in the study larger so that it can truly be generalized to everyone.
And what was interesting about this article is that they wanted it to be a general population because occupational therapists utilize the natural environment so much when working with kids that have sensory processing disorders or issues. So that was pretty interesting.
I mean, I thought it was a great idea to
Yeah.
not just target it on people with diagnosis because, like we said in class, we all have some kind of sensory processing
Lower high.
issues.
Yeah.
Yeah. So it is a great resource. I just think pick one
They didn't
or
go about
increase
it
the
like,
size of your sample size.
and you feel like they kind of didn't go about it the best way that they could have.
I think so, yeah.
So the research question that this article had was, what is the relationship between parent-reported sensory processing patterns and behavioral characteristics such as protective factors like adaptability or resilience and challenging behaviors of children ages 6 to 11 with and without specific conditions? Okay, and also to what extent, it was kind of like the same question, but like to what extent do those patterns predict challenging behaviors?
And this study was quantitative. It was also a cross-sectional. So what they did for the study was it's kind of interesting. We realized that they didn't include exactly how they got the participants for this study, which was, we thought, a little fishy, but we're trying to figure out exactly what happened there. But so they used individuals between the ages of 6 to 11 years old from across the whole United States because, again, they wanted to try to apply the generalization aspect. And what they did was they used 2 different assessments, and I'm guessing that they mailed them out to the parents, and the parents filled them out based on how they felt their child reacted to certain things. And it was interesting in the article, one of the things that I was reading that like kind of jumped out at me was that they were saying in regards to the results, how there might have been some bias because the researchers were never really in contact with the children. It was just the results that they got from the parents. So they were saying how the information that they got from the parents, that, you know, some of the things that their children do may have not necessarily have jumped out to the parents. Mm-hmm. So that might have like thrown some bias at the results and like just made things like not exactly how they wanted it to be.
I also think that it's not pure quantitative research because they are using a mixture. They are using interviews and not just purely what purely is done in quantitative. So there is even though it's not called a qualitative study, they are using interviews or
but the assessments were standardized.
Right.
I understand that.
They were, and they even mentioned, just to jump back quick, the assessments that they used for methodology, they used the Child Sensory Profile 2 by Winnie Dunn, and then they used I always forget the name of this one, the Behavior Assessment System for Children. It's a parent rating scale. So they're rating the characteristics and sensory processing characteristics of their kids. And the Child Sensory Profile is I guess they're both standardized assessments. That's why this article says that it's a standardization study and that we had to see done 2014 for more detail on how they recruited these kids. So I think maybe there are specific guidelines as to how to conduct this study.
And we tried to look for it. We weren't exactly how to go about looking for it. We think it might have been some type of guidelines, like Allison was just saying, in the assessment itself. And it's the sensory profile that we have access to in childhood. Mm-hmm. But I went on the website, and of course you probably have to buy it to get access to everything. But so again, we think that there's just certain guidelines that they had to stick to, but it just wasn't included in the research article. And I kind of have a small issue with that, but Savannah was pointing out that it might have been a whole entire page. So
it's also
I digress.
What we're coming from that is that if we wanted to duplicate this research, we can't. Because even though we know the population ranges that they use and who they use more or less in terms of do they have a disability or not, they're not specifying how they recruited. So
that's probably the purpose why they did that.
Maybe
they don't want us to know secrets.
Maybe, but it means that we cannot duplicate this research.
So they answered the BASC 2 and they did the Child Sensory Profile 2. The Child Sensory Profile had 4 patterns. It was seeking, avoiding, sensitivity, and registration. And then the parents kind of not described because this is quantitative, but they scored their child on those behavior characteristics. Maybe they crave sensory input and things like that.
And just how they responded to different sensory stuff. They also, it was just all that. And I noticed I think it was with the Basque too. They pointed out that it was different from the other. Oh geez, it was different from the what was it, the CSP2?
Mm-hmm.
It was different from that in that it looked at the reaction from how the child received the sensory input and then how they reacted, whereas the CSP2 I think just looked at how the child received the sensory and not so much how they reacted. So that was interesting to see.
And they created a multiple linear regression model that they used to identify like the sensory predictors. So they had found that children with increased avoiding behaviors showed increased externalizing. Externalizing behaviors would have been like aggression, conduct, and hyperactivity. Whereas increased sensitivity was associated with decreased externalizing behaviors. Children with avoiding behaviors, they can benefit from occupational therapy because increased externalizations might help them develop better coping strategies.
Right. And we said that when it comes to avoidance, it's this article kind of view it as a negative thing, obviously, because they are being violent. So this article, the main topic of it is let's kind of detect what is their coping style so we know how we can help them. So if we know that somebody is avoiding, then these are some of the reactions that we might anticipate, and this is along the line how we should help them. So it does have good implication for OT.
And just to go off of what Savon was saying with the avoidant aspect, so I personally think that I'm an avoidant type. I have at times a low threshold when it comes to receiving input on like sensory things in my environment, and I consider myself to be passive when it comes to reacting. So if I hear a noise, I have to turn to see what it is, and then I'm fine with it, and the noise can continue.
That's interesting.
And so I think I'm avoidant. And this study, it pointed out that people that have avoidant type personality with their sensory, that they have good adaptability, but then it said that they don't have resiliency, which I don't agree with.
Because
So that's a good question for everybody to think about.
Yes.
Because we were kind of thinking, how can you be adaptable, but yet you're
not resilient?
You're not resilient. Because, like I said at the beginning, one of the synonyms of resilience is the ability to cope, stress management. So
if you're adapting,
aren't you
should
coping?
be coping.
Exactly.
Food for thought.
Just want to give you a little more information on the results. They found that sensory seeking and avoiding were predictors for depression. Diagnosis and avoiding were predictors for adaptability. And sensory sensitivity predicted decreased externalizing, like the aggression and hyperactivity. It is interesting because past research, they had found that there was they had found evidence that in internalizing behaviors, there was a connection between internalizing and sensory processing, but our researchers didn't find that connection. That's probably based upon what behaviors the parents saw of their kids when they were reporting this, so that was interesting. But, so that could be a limitation. Like we were mentioning earlier, the sample of 51 was kind of too small for the amount of information that
they were looking for.
They gathered, so that could impact the external validity. And
one of the limits.
Yeah,
of the
that's
study.
one of the limits. Some clinical implications that our study found or gave to us was that sensory processing differences, they impact a child's behavior, which we can see that in anything that you're doing every day. You know, how quick are you reacting, or do you plan? Do you have an active self-regulation? Do you plan before you react? Things like that. Characteristics of the surrounding environment are important to consider for all kids.
Because it's really, sensory processing is really how we react to our environment. So that's why the environment is such a huge impact. I forgot to mention before, in one of their limitation, they are talking about that while they didn't depict some of sensory behavior, that could have been due to the small sample size. And if they had a larger